On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey, good evening, everybody. Welcome to another episode of Talking with Dr. Donna. I am Dr. Donna, your host, and I am so excited that you have kept your appointment with me tonight. Tonight, I have a fantastic guest with a great topic of conversation, and I think that you all are going to be educated tonight, right? My show is about building generational health. It's about ending premature deaths in our community, and that's premature deaths from natural causes, as well as premature deaths from suicides and homicides. We're building a network for generational health, and that means emotional and mental health, that means spiritual health, that means physical health, and environmental health. And so tonight, as we start talking with Dr. Donna and this topic of kids, identity, and sex, I'm happy to have my friend, Dr. Inwards-Breland with us. We'll meet him in a moment. But first, I wanted to just talk a little bit about this topic because I know it's a hot topic. And I know that it might be upsetting for some of you. I understand. I know that for some of you, it may go against your values and your own personal beliefs, and I understand that too. Some of you may feel uncomfortable about talking about these issues, and I understand that. But at the end of the day, you're talking with Dr. Donna, and Dr. Donna is a Christian. Dr. Donna is a pediatrician. But first and foremost, Dr. Donna is a mama, okay? And as we're talking about our children, these are our children that we're talking about, and that is somebody's baby. So regardless of whether you want to accept what is around or what we are dealing with now, your kids are dealing with it. Some of your kids may just be talking about it. Some of your kids may be hearing about it, but some of your kids may actually be experiencing this. So we want to make sure that we educate you as parents, that we understand what it is that we're talking about, and that you can then begin to build a relationship of understanding with children who may be questioning or experimenting or dealing with these issues. That's what we're about on this show, building generational health. This is a part of health. So I hope that you do stay tuned. I hope that you listen with an open heart to hear what we have to say about tonight. So I want to bring on, before I start and introduce my guest, I forgot. I wanted to give a shout out and a birthday greeting to my big brother, Tony. Happy birthday, brother Tony. I love you. Thank you for being so much to me. Could not have a show on your birthday and not give you a shout out on your birthday. So happy birthday to my big brother, Tony. All right, let's bring in our guest tonight, who's my friend. I'm so excited to have him on. This is Dr. David Inwards-Breland. He is the Division Chief of Adolescent Medicine at Rady Children's Hospital and co-director for the Center of Gender Affirming Care and clinical professor of pediatrics at the UC San Diego School of Medicine. Woo, that's my friend. A native of Southern California. Dr. Inwards-Breland did his medical school, let's start with undergrad. Let's not jump the gun. Did his undergrad work at UC San Diego. Then he went and got a public health degree at UC Berkeley. Then went back to receive an MD degree at UC Davis. Now if this is not a poster child for the UC system, Dr. Inwards-Breland. I didn't know that you just UC'd all of the UCs. And then he did his residency at Benioff Children's Hospital, Oakland, which is where I met him as a resident. We traveled together. We had a fantastic month together. I'll never forget, in Zimbabwe. That was such a great time. And after residency, he did a fellowship in adolescent medicine at UC San Francisco. He is interested in adolescent male health, depression, transgender and non-binary youth, and disenfranchised youth. He also sits on the American Board of Pediatrics in the sub-board of adolescent medicine. All right, talking with Dr. Donna, let's welcome in my friend and guest for this evening, Dr. David Inwards-Breland. How are you?
I'm good. How are you?
Good. So good to see you. Thank you for being here. So, good. Can you hear me okay?
I can hear you.
Okay, fantastic. So I want to tell everyone, if you have a question, you can put your question in your chat. I'll be monitoring the chat line on my Facebook page, but also monitoring on my YouTube channel. So if you have any questions, please do put them in the chat and we will monitor them. And so we can answer your questions live. As you know, April is Sexual Assault Awareness and Prevention Month, and so we're spending time talking about sexual assault awareness and prevention in multiple different populations. And so tonight, we're going to talk a little bit about sexual violence in the transgender community, sexual violence in the LGBTQ community. And we're just making sure you can see it there that about 50% of transgender community has been affected by sexual violence. We want to prevent that. We don't want that 50% to continue. We also, next slide please, also want to talk about the number of kids that we have impacted as LGBTQ communities. It's a big community, a lot of kids. So Dr. David.
Yes.
Could you please help us out? What do these letters mean? What does it mean for LGBTQ? And I know there's a plus on the end. Can you tell us what do those letters mean?
Sure. It is a long alphabet soup, I have to admit that. And so with L, that means lesbian and someone who is same gender loving of female. So a female who is attracted to other females. Gay is usually a male person who is attracted to other males, but also lesbian folks can also identify as gay. Bisexual, B, is someone who is attracted to both sexes. T is transgender, and I want to also add non-binary, that's not in there. Q is questioning. And then the plus, it's like LGBTQ A++. A is asexual. There are people who do not have a sexual orientation. And the plus could be, particularly in our Native American communities, two-spirit. There are people who are born with what we call ambiguous genitalia. So those people may have different genitalia than what other people would be born as. And so that's part of that.
Wow. Okay. So that's a lot.
That is a lot.
It's a lot. And I know, go ahead, David. Go ahead.
The word queer was derogatory in my day, but our young people have really reclaimed it. And you could say queer youth, you can say queer people, you can say gender queer. It is really a umbrella term now that could be used by people to describe this population.
All right. And so, you know, You said in your generation, the Q is something that we just did not use. That was derogatory, and it's not anymore. And I think it's so important. That's why I wanted to start out talking about what these things are, because I know I hear these, these words, and I sometimes get confused. Like, hey, what does that mean? And one of the things that I love that you said to me when we were prepping for this show is that you said that gender identity is different from sexual identity. So can you explain, what do you mean by that?
Gladly. I think, to put it simply, sexual identity is who you love, who you're attracted to. And then gender identity is who you feel that you are in your brain. That's the difference. So there's definitely different constructs. There's different developmental trajectories that go into gender identity and sexual orientation. So that's very important, because oftentimes I have parents come to me and say, well, I thought my son or daughter was gay or lesbian. And I often say, well, that could be the case, but that has nothing to do with their gender identity. So who you love is sexual orientation, and who you are is gender identity.
Got it. Thank you so much. So, we were talking about LGBTQ and that population, and we know that affects roughly about 1.3 million kids. That's about 8% of high school students in America report being lesbian, gay, or bisexual. And I bet that there's even more, because there's other terms now, right? And so that's a lot of kids, right? That's a lot of kids that are impacted, that are dealing with something that a lot of people just don't get or understand. So I wanted to just say and just recognize that we are here tonight because we want to hear these voices. We want to understand. And like I said in the beginning, is that these are people's kids. This is somebody's child. And whether or not you as a parent understand it or believe it or feel like it's aligned with what your personal values might be, that is still your child. And you want to love them and support them. And so tonight, we're really trying to give parents some tools and some knowledge about how to love and support their children who might be any one of these letters that we've talked about. What do you tend to say to parents as they come into your clinic?
Yeah, you hit it right on the nose. I congratulate them for bringing them into the clinic, because I have to admit that there's patients that I don't get to see because the young people don't have access to come in and see me to get the services. But I really rely on them loving their child. And I start with that love that they have for their child, and then incorporate education. I incorporate definitions. I incorporate all the things that a person should know about the LGBTQ plus community. And then I often take a step back and have them tell me what they heard. Because oftentimes, it's a lot of information, and sometimes we only we retain a few things that are told to us, and so I really kind of go back to them and see what they understand about what I've said. And I think the key is that they really love their child and they want to understand, and that is key. I have to say that family support, family understanding, or even if you don't understand, you love your child, that goes a long way in supporting the mental health of these young people. There's a study by Kate Lynn Ryan out of San Francisco, who looked at parental support of their LGBT youth. And what they found was that there are those people that had no support from their families had high rates of depression, high rates of suicidality, high rates of suicide. And those who had parental support, I'm not saying that they totally understood it, but they supported them to be healthy individuals, those rates went down. So it's super important to make sure that the parent knows that they love their child and to be open to being educated.
That's great. I think it's so important as parents. There's so many things we don't understand about our kids. This is not our generation. And just as we try to understand their music, we put effort and energy in trying to understand their music, how they dress, their friends. Why would you not put energy and effort in trying to support when they're trying to tell you that who they are may be different than who you think they are?
Mm-hmm, mm-hmm. Yeah.
So I know we're going to talk a little bit about resources later on in terms of what we can give for our parents. But I want to kind of go back and ask what made you get interested in this work that you're doing?
Thank you for asking that. In fellowship, I actually attended a gender affirming clinic, and what I saw really shocked me. I saw people of color, mainly, who were either homeless or newly diagnosed HIV, having STDs, having sexually been assaulted, and actually those transgender women buying off the street, silicone to change how they look. And really, I took a step back and said, all I have to do is affirm who they are and medically help them. I could do that. And so that's why I got into this field, is to be an advocate for young people to do things as safe as possible in a medically, medical field or medical environment.
So there's two terms you used in there in your answer that I want to have you flesh out a little bit more. You already talked a little bit about transgender, but that type of I don't know what is the term. I want to make sure I'm using the correct terms for myself.
Right. Well, transgender is an umbrella term that encompasses a lot of identities. So if you think like I was a born male and identify as male, and so I am a cisgender individual. Transgender individuals are people who were assigned a sex, but they do not identify as that sex. And so transgender could be, non-binary, could be gender fluid, could be, trans male, trans masculine, trans female, trans, feminine. So there's a lot of terms, but that transgender is the umbrella term.
Okay. And so in using transgender sort of as a female, I was assigned the gender of a female by my parents, but I don't feel that I'm a female. I feel that I am a male. And that
you were assigned the sex. It's based on what the genitalia looks like.
Okay.
Basically, that's it.
That's right. Okay.
Female at birth, and so if you did not identify as that which was assigned to you, but you identified with something else, that is transgender. That's non-binary. Non-binary individuals are people who, maybe identify as both or neither or somewhere in the middle, or and it switches. So that's non-binary, but really, I think that's very important. We're not really assigned a gender. We're assigned a sex, which is related to chromosomes.
Right. Okay. Thank you. See, this is why you're here. Thank you. I just want to take a quick pause and remind people, if you have any questions, to please put the questions in the chat. We're monitoring, and we will make sure to ask Dr. Inwards-Breland those questions before we leave. Okay, great. So we transgender. I think hopefully that's clear for some people. So in terms of looking at the numbers, you can see here, there's over 150,000 youth between the ages of 13 and 17 identify as transgender, and over 1.4 million adults identify as transgender. And so we're talking about people, as in one of the things that I also wanted to have you on for is because we're talking about young kids. We're talking about kids who are 13 or sometimes even younger, recognizing that they feel differently than they were assigned, right?
Yeah.
And so that is that's quite a number of people, and it happens quite young. And I think, how do you talk to parents about communicating with their children about how they identify? Like, what type of, how can you have that type of a conversation? What do you suggest?
I have to say, before I answer that question, those numbers that you gave is an underestimate, uh,
Mm-hmm.
because if we think about national data sets, they don't really ask about gender identity. So
Mm.
that number is probably much higher than what you state. As far as parents, I think I encourage parents to talk to their young people about everything,
Mm-hmm.
about the types of music that they enjoy, their friends, of course, what sites they're on, and what
Yes.
interests them. And many times it comes out in that sense. Also, be neutral when speaking about people. If there is a person who that comes across the parent and the child, and that person is gay or transgender, you can bring that up. What do you know about gay, lesbian, transgender folks? Do you know anyone? And
Mm-hmm.
sometimes that comes up. I would say that it's really hard to talk about sex and about identity in with adolescents. But I think you'll be surprised if you talk about it and you ask, you might get some information that you might not know how to handle, and that's okay. That is
Right.
okay, because you can utilize the patient, their child's pediatrician or family doc to kind of
Mm-hmm.
get the knowledge. Also, a lot of these young people are super knowledgeable. They follow these trendsetters on Facebook and YouTube, and a, a lot of times they get information and are very knowledgeable, but some of it is misinformation. And I think
Mm-hmm.
finding out what they know, verifying with your own research and talking to your physician, I think that is the key. But again, just asking and being open, being willing to accept what your young person is going to tell you.
Yeah, now that's the key, because sometimes you do ask questions you do not want to know the answer to.
Like, oh, okay.
But it is so important to have that communication. And I do want to underscore what you're saying about really knowing what your kids are watching, what they're doing online, particularly during this time of the pandemic when everybody is at home and everyone's in their own rooms or own spaces. You may not be, you're not watching TV together. You may not know what your kids are looking at or watching. So you have to ask those questions. And, teenagers, they don't really want to talk to you. You remember being a teenager, you didn't want to talk to your parents, but you have to make them. You have to have them come out of the room and say, let's have some time to talk. Or go into their room and sit on their bed and just have a conversation with them. But talking is so important. There was another term that you used that I wanted to call out, and that is gender affirming. What does that mean, to be gender affirming?
Yeah, so there's gender affirming, I would say gender affirming care, gender affirming medical care. Gender affirming is using someone's name that they go by, also their pronouns that they use. That is probably the most important piece of gender affirming care that you can give a person who's transgender non-binary, because we know that young people are misgendered left and right. And when, just imagine you are I'm assigned male at birth, and I go to a clinic and I identify as male, but someone says, "Oh, ma'am, can I help you?" I'm like, or she or her. I'm not a she or her. That's not my pronouns. And so I'm like, it's really, really irritating a lot of young people feel that when they are misgendered, they're not called by their name that they go by or their pronouns, it's violent. It's almost like, I'm sure you've talked about microaggressions.
Mm-hmm.
It's actually macroaggression for
Mm-hmm.
people. Also, gender affirming care is, social transition, allowing young people to be who they are, the type of hair that they want to have, the clothes, their gender expression, how they want society to view them. Gender affirming medical care includes particularly with minors, includes a mental health assessment, really looking at um, any mental health problems like depression, anxiety, and is it treated? Where the parents are in the whole process. Are they safe at school if they transition? Are they safe in their environment? So though that goes into gender affirming care. And then if a young person is insistent, persistent, and consistent with their identity, and they've done this evaluation, you can provide gender affirming medications. There's pubertal blockers, which for those younger patients, it just halts puberty, is fully reversible. So if they stop taking it, it reverts back to where they were before. And then there's sex hormones like estrogen and testosterone. That is also part of gender affirming care. There's also gender affirming surgical care. And right now, most of the gender affirming surgical care is being provided at the age of consent, which is 18 and up.
Okay, thank you. That was exactly going to be my next question, because I know a number of parents have come to me and said, aren't these kids too young to be making this type of a decision to take either medications like the hormones that you mentioned or to do surgery? What do you say to that, with that question of, are they too young to make that type of a decision?
Well, if they're very young, and usually puberty starts in assigned female at birth, can be as young as 8, 9, 10, and assigned male at birth could be a little older, 12, 13, 14. If you stop the puberty from progressing, it's really buying time. It's allowing young people to continue to explore who they are and make sure that that's really who they are and want to move forward. Those older individuals who are not, so basically most 12, 13, 14-year-old people are candidates for pubertal blockers. And so I think that with adding the pubertal blocker and buying time, getting them the services at a gender clinic or their primary care provider, getting resources in the community, all those could actually be done during that time that they're kind of buying this time to explore. As far as hormones, when we think about hormones, a lot of it, much of it is permanent. But let's think about someone who is on testosterone. The permanent changes would be a deeper voice, hair growth, and growth in the bottom area. Okay. Now let's think about that. If they change their mind, which is super rare, they can shave, they can do electrolysis. There are assigned females at birth who have deeper voices, and it would never be as deep as someone who is assigned male at birth. And then no one has to know what's below in their pants. And so, though, and I often tell this to families that even the changes, those permanent changes, can be changed in some way. So, and then we talk about the medications, and they're very safe. They've done longitudinal studies looking at hormone levels, risk of diabetes, high blood pressure, and they are very safe in pediatric population and in adults. So I think that the next thing that I tell parents is, if they are not who they feel in their head, who they are, that their gender identity, it increases the risk of depression. It increases the risk of anxiety. It increases the risk of them taking their lives. It also increases the risk of them being victimized, because if they are identifying one way and they don't look the part, people, they're at risk.
Mm-hmm.
And so, I think allowing the parents to understand that they could really eliminate or decrease a lot of the mental health comorbidities and the violence and if patients are allowed to transition. So looking at the mental health considerations, looking at the medical things that happen, um, basically that's what I tell parents, that as they go through puberty, their gender identity, their sexual orientation solidifies. And by the time they are older puberty, they know who they are. Now, people will often say, well, I heard of a 17-year-old just, say that they're transgender. Well, if you talk to that person, they always felt different. They also thought, oh, I must be gay or I must be lesbian, which is two different things. And so with that, I often tell families that just listen to their child, listen to what they're telling you, and once they sit down and hear that they are telling them that they are the gender, sometimes something just clicks in parents. And so basically all those things is what I kind of explore with families.
Okay, that's great. Thank you. I think it's, you keep saying it, and I have to keep like pounding it into my head that gender identity is different from sexual identity. And so if you have someone who's transgender, but they are attracted to someone who is now their same gender, what do you call that? Because I get that question all of the time.
Awesome. You call it what they call it.
Okay.
I know that's going to be confusing to people because you basically ask them how they identify. There's a lot of terms, and I'm sorry to kind of bombard you with. There's pansexual, there's demisexual, there's just all types of different identities as far as sexual orientation. But it's basically how they identify. For example, I have a patient who is transgender male who is attracted to assigned males at birth. And that's his pronouns, he's told me, he identifies as gay, a gay man. And then they have someone who is assigned female at birth, assigned male at birth, who is now female, who is attracted to, men. She may call herself heterosexual.
Yeah. So I think that
it's really the behaviors and
I think the key though for us, because I'm sure, I'm seeing people in the chat are like, what? I think it's kind of blowing their minds, but I think the key is that you don't have to figure it out, right? It's not for me to figure out what you are, right? Or what they are. It is for us to ask them how they identify and then to address them as they identify.
Exactly.
That's great. So I know
I often tell my residents, you ask what their sexual orientation is, but also ask their behaviors, because their behaviors may not be consistent with people's notion of their sexual orientation.
Got it. So you mentioned briefly about assault. And as I mentioned at the very beginning, April is Sexual Assault Awareness and Prevention. Ideally, is Prevention Month. What do you know or think about sexual assaults in this community?
Yeah, as you pointed out, and there were some statistics that you gave. Transgender or LGBT youth are definitely at increased risk than their heterosexual or cisgender counterparts for sexual assault. Now, if we look at transgender and non-binary, that they're like 3 times the risk of their cisgender, and even higher than the lesbian, gay, and bisexual group. And so it's shocking, the number of people that have been surveyed in studies that admit to being victimized in some way throughout their childhood and their adulthood. The other thing that I want to point out is victimization is even higher in communities of color. So you mentioned in one of your statistics that transgender women have high rates of being murdered, really high in trans women of color. So, racism also rears its head in discriminating against these young people, and they're dying.
What do you say to communities of color about this whole topic that we're talking about tonight?
So oftentimes I often say, people say, well, that doesn't occur in the Black community or Mexican. Well, it does. And unfortunately, the stigma around, going to the hospital, talking to doctors is another blow to these young people or these older people who are of color, because they don't want to go to the doctor because they're going to get discriminated. They're either going to get discriminated based on their gender identity or sexual orientation, or they're going to get discriminated based on what they look like. So I often will talk to communities of color and say, yes, it does happen in our neighborhood, in our families. It does happen. Knowledge is key. Find out, what is happening in the community, and really encourage communities of color to seek help, seek care. Because if they don't seek care, those disparities, like high rates of HIV, substance abuse, will continue to increase. So I think in communities of color, we need to support our own, and then we need to get them the help that they need, and the preventative services that they need.
Yeah, and I think especially during this time of the pandemic over this last year, where kids were isolated, so they might have had a support group at school, right? And so they might have had friends at school who they could talk to and share what they were dealing with. But now that they are home and may not be in a home that is as supportive or affirming to what they're identifying as, I think that has definitely, I feel, led to the increase in depression and anxiety, and definitely suicides in this age group. What do you think about that? Do you agree?
Yeah, I totally agree. There was a couple of studies out there that looked. The title was "I'm gay, lesbian, transgender. I'm stuck at home because of COVID, and my parents are supportive." Definitely higher rates of all those things: depression, anxiety. Also, believe it or not, higher rates of homelessness. These youth are leaving the home because they just aren't supported. And unfortunately, the homeless youth have a increased risk of all those things that we talked about: substance use, victimization, STDs. And so I think that the COVID pandemic has affected everyone's mental health. And just imagine if you felt different or weren't supported in your environment, how could you have gotten through this past year? It would have been really difficult.
Yeah.
If you have this support from your husband, wife, children, parents. And so these young people are definitely at risk. Also at risk for victimization and abuse from their families. They can't get away.
Yeah.
They could leave the abuse when they go to school, but if they have to stay at home, they're more at risk.
Yeah, that's sobering to think about. We've had, just over the last couple of weeks, I have, I would say 2 degrees of separation between a 9-year-old boy who hung himself and then a 12-year-old girl who committed suicide. And it's heartbreaking to think that our children who might be dealing with issues that, like I said, you may not agree with, you may not understand, but can't find an outlet to talk to anyone about these issues, and they end up harming themselves. And I think as a community, we need to understand that this is not about anything other than making sure that we take care of this next generation, that we make sure that we support them, that we affirm them, that we protect them from anything that is harming them. So thank you. I thank you for that.
I do want to mention, one other thing is being stuck at home and being on in front of a camera. Cyberbullying has increased exponentially, and so these young people can't get away because they have to be online to get their their studies. Also, their social media is their lifeline sometimes. So they're continuing to be bullied, and so that's really important to know. But also, and this is another reason why parents should know what their kids are looking at, because sometimes there's these online groups, and they're adults masquerading as young people. And so that is really important to kind of know, to ask questions about, hey, have you seen this person? Do you know that they're really 13, 14?
Right.
And talk about scenarios, with their young person.
Right. Okay, there's a couple of questions in the chat that I want to get to. One is, I think you've answered this, but I'm going to ask it so you can answer it clearly. What's the difference between heterosexual and cisgender? Are they the same?
No. So someone who is heterosexual is again, sexual orientation is who you love. So a heterosexual person is attracted to the opposite gender, sex. And cisgender is someone who identifies with the sex that was assigned at birth. So for example, I was assigned male at birth, and I identify as male. So I'm a cisgender male. So they're 2 separate things.
Got it. Okay. I'm sure we're still going to have questions after tonight.
It's hard to break them up, sexuality, gender, it's all really confusing.
Yes. Okay. So you talked about the medications that you can use to change your hormones and your gender. How much time can you take the medication before it starts to before it's too late for permanent changes? I think is what they mean.
I gotcha. A lot of times people, for example, someone is an assigned female at birth is going on testosterone. A lot of parents think that they're going to wake up looking like an Incredible Hulk. They're not. It's a slow process. Just like puberty, the puberty that everyone goes through, it is a slow process. All of a sudden, your child is like, grown.
Right.
But there was a long period of time where you just didn't really look at it. So I would say some of the permanent changes, the voice is an early change. And then hair growth can be variable depending on ethnicity, race. And so I would say full hair growth on a transgender male can take up to 4 to 5 years. So it's not a quick process. A trans female, as far as breast development, I would say that it does happen pretty early, but depending on their build, they're probably not going to have a lot of breast tissue, just genetically. It's not going to be. And so, as far as clothing, you can hide that if you're worried about safety, etc. So a lot of the changes that occur is a slow process. It doesn't happen as quick. Now, my young people want it to happen quick. They wanted it to happen like 5 years ago.
Right.
And so I often have to do some what we call anticipatory guidance. That you got to be patient. It's not going to happen overnight.
Okay, that's good. Um, if you have a child that is questioning, what steps should you take to support them?
Yeah, the first thing that comes out of your mouth is, I love you, and it doesn't matter who you love or who you are. I support you to the best of my ability. Goes a long way.
Mhm.
And then ask them, do they want to talk to their doctor? Do they want to talk to someone in the community? Do they want to talk to someone? Most teens says, no, leave me alone. I don't want to talk about it. I'm questioning, I'll figure it out. A lot of times they'll figure it out. And so you don't need to get them, quote unquote, help. Also, I think it's good for parents to have resources that they can go to. So there's resources on the internet about support groups for young people that is vetted by medical providers. That is true, not reparative therapy, and offer that to the young person. Also offer to go to support groups. Usually schools have gay-straight alliances, and if that person is part of that group, if there's a function, as a parent, go to that function, and you will learn a lot. So as far as going to see someone, I think using your primary care provider, using some vetted resources on the internet, and then just loving them and accepting them and let them explore who they are, because eventually it'll come out.
That's great. And we actually have some websites that we will share at the end. So you can see here we have lgbtqmap.org is a website. We have a bunch of resources here in the Bay Area on these websites. And we'll put all of this actually on this episode on the channel. So you can come back tomorrow and actually, look at this episode again, and we'll post it into the actual comment section of this episode so that you can get these resources. There's also some parent resources. Like Dr. Inwards-Breland said, there's lots of ways to get some assistance as a parent. We also want to make sure that you have this, we're talking again about sexual assault awareness and prevention. So here's a 24/7 phone number, 24 hours a day, 7 days a week that you can call if you feel like you need help or you know someone who may need some help. There's a suicide prevention number here. Write these down. Like I said, you can come back, look at this episode, and it'll also be in the comment section of the episode that you can always come back and refer to. So if you need these phone numbers or someone that you know might need these phone numbers. Dr. Inwards-Breland, this has been quite educational, and I'm so thankful that you have come on. And like I said at the beginning, this is really not about my personal values, my personal beliefs. It's not about talking about, Christian theology. Like, you're going to have to hit me up on another time for that topic. That's that conversation. That's not what tonight is about. Tonight is about really supporting our children, because there are children who are, again, hearing these things, talking about these things, questioning these things. And we want to be able to support and love on our children. We don't want this next generation harming themselves around these issues. And so that's what this episode is about, giving you as parents tools and resources and suggestions and recommendations on how to talk to your children and what to talk to them about. Because our children, these are your babies. And we know that you love them, and we want to help you show them that you love them. I'm going to give you the almost final words, but anything else you want to say, Dr. Inwards-Breland, anything we didn't touch on that you wanted to make sure that people were aware of?
Yeah, no, I thank you for having this segment. I think it's very important for particularly a person of color talking about this stuff. I think that's very important. And so thank you for inviting me. You can also go to UCSD and type in my name, and there's my profile. There's information on the website. And then the last word is love your children. Let's support them safely and effectively by partnering with them and professionals.
Awesome. Thank you again for being on. Thank you for watching out there and opening up your hearts and minds to love on our children. I'm Dr. Donna. This is another episode of Talking with Dr. Donna. Remember, you have an appointment with your doctor every Thursday. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment